Assalamu alaikum and good morning. I'll welcome you all viewers and the lecture of the series of the public health. In the today lecture of the public health, we will learn about the another important topic, which is the part of the social health protection. This is the third model which is used in many countries of the social health protection model. The name of this social health protection model is National Social Health Insurance Scheme. So let's go more in detail about the National Social Health Insurance Scheme. In the social national health scheme, health insurance scheme, is the government is the wholly solely in charge, in which government collect the premium in the form of the collect the revenue in the form of the premium or in the form of the taxes for the social health protection scheme. And through this pooled revenue, the government will be the single payer to provide the funding to the doctors, clinics, or any hospital from whom the citizen or from whom the insurer will get the healthcare services. Under this scheme, mostly the hospital or the healthcare provider, the doctors, the clinic and the hospital are run under the private sectors, and this private sector will get their fund reimbursed from the government. So by this mechanism, the government will keep strict monitoring and eyes on the cost controlling, and the government will be the wholly solely in charge to improve the quality of the care and monitor and evaluate the quality of the care which is provided in these private sectors. Either it is provided by the doctors, by the hospital, or by any healthcare centers. Under this National Social Health Insurance Scheme, the health coverage will be covered from prevention, promotion, treatment, until to the rehabilitations. All the four stages of the healthcare services or the disease process by which any individuals or the communities has been gone through, the government will provide the funding for that. And this National Social Health Insurance Scheme, every citizen have the mandatory to submit or deposit their premium for their health insurance. Without depositing of the premium of the health insurance, the government will not provide the healthcare services. So this system is mostly run in the Canada, Taiwan, and so many other countries. Because this system is very easy, and the government is collect the money. Government is in charge or execute the money and the reimbursement of the payment on the behalf of the individuals or the community to the doctors, to the clinic, and to the hospitals. And the government is the wholly solely in charge to collect the revenue for the health insurance in the form of the premium or the form of the taxes, mostly in the form of the premium. And under this system, the mostly of the healthcare services will be provided by the private sector. It may be a doctors, maybe healthcare providers, maybe healthcare center, is a maybe tertiary care hospital. And this system is mostly run in the Canada, Taiwan, and so many other countries. I hope in the today lecture it is clear your concept. What is the National Social Health Insurance Scheme? National Social Health Insurance Scheme is another form of the model of the social health protection. As we discussed in the first lecture, that the social health insurance scheme is a program or the policies by which a government will provide the healthcare services whenever any community or the individuals would like to access the healthcare services. When the community or the individuals access the healthcare services, he will not face the hardship of the healthcare expenditures. This is the main mechanism of the social health protection. So by this mechanism, the productivity will not be reduced and the productivity of the individuals or the community will not be stopped. The productivity of the community and the individuals will be progress. If the person remains well-being or healthy, he will increase their productivity and the contribution of their society, community, and their national levels, and even though in the global level. I hope in the today lecture is clear your concept about the National Social Health Insurance Scheme. For such type of the informative lecture, keep touch with the HPH YouTube channel and subscribe the YouTube channel. And in the last, I request to press the bell icon, which is you are looking at the bottom of my video lectures. By pressing the bell icon, you will get new lecture as soon as I upload on my YouTube channel. Thank you so much. Allah Hafiz.